Taking a peripheral arterial blood pressure is a very important hurdle to overcome in an OSCE. It can make or break the rest of your routine. I have, tragically, witnessed numerous occasions when medical students and even postgraduates have become completely unstuck with this seemingly simple bedside procedure. Let us go through the stages of learning this skill and make sure you are never going to stumble. The relevant clinical anatomy. Firstly, review the surface and clinical anatomy of the radial artery and its pulse, and the brachial artery and its pulse. There are separate video clips on both of these arteries, and we'll just review them very briefly here. This next clip shows a time-efficient technique suitable for an OSCE. Practiced often and use different people and different types of cuffs. The more the better. I'll now keep quiet and let you study the entire performance from start to finish. Exam pitfalls and how to get yourself out of a bloody hole. Problem number 1. Not knowing the relevant surface markings of the radial artery and the brachial artery. This is simple. Pay close attention to the first part of this video and then go back to specific video clips elsewhere in this program for more in-depth discussion if you need it. Problem number 2. The cuff is not on the correct way and it keeps slipping open as soon as you start pumping it up. I've seen this many times with students just not familiar with the process and just spend minutes and minutes stuffing around. It's awful and you just have to practice beforehand. You just have to. It's a disaster if you let yourself get into that situation, and it can happen to the best of students, by the way. Solution: familiarize yourself, if at all possible, with this institution's actual blood pressure machines to make sure you know which way is up and which way is down. In other words, know well in advance how to apply the cuff in the right orientation and not inside out or upside down. Problem number 3. With an automatic machine, you keep getting an error message. Likely, you do not have the sensor sitting over the brachial artery. Find the indicator on the cuff that designates the sensor, which is going to be a miniature condenser microphone, and make sure that this is centered over the brachial artery. Again, refer to the surface anatomy of the brachial artery at the beginning of here and also in other video clips.